Hello.
Hi, happy hump day.
Happy Hump Day. Oh, this is well, the penultimate episode of the 2022. We're
Mm.
like, I don't know if we're frantically getting ready for Christmas. I am. It's not far away and still got a lot to do.
Yes, I'm more of a turtles pace kind of a person, but yes, it's
Uh,
good.
it's getting there. I like your earrings. I think
Oh, thank you. These I probably wouldn't have bought myself. I got it as a Kris Kringle present a couple of years ago. So finally making use of it. So that's good.
I'm trying to get my Santa in the shop,
Yeah.
but it's not really working out.
Mm,
Anyway,
yes.
oh, good.
It's
So, what are you looking forward to?
yeah, 2023 might be a good year. So you never know.
It's full of possibilities. Anything can happen.
Full of possibilities, exactly.
And what do you want to happen?
Oh, I don't know. Trying to decide. I should have thought of this before, but I don't know. Maybe more work-life balance. That would be nice. Yes.
Okay.
Figure out
So more life or more
more
work?
life. More life. There's been a little too much work, so
Okay.
more life. What about you?
Me, I will be different opportunities to grow my business.
Hmm.
Exploring different opportunities. That will be my focus. And dating.
Dating, yes. Oh, yeah. Wow. Hmm.
Those two things will
I
be.
wish you luck with them because I think the business will be easier.
Yeah,
But
I
you
know.
never know. You never know.
You just never know. Mm.
Exactly.
Yeah. So those are things I'm looking forward to in 2023.
Mm.
And seeing family because my mum's coming to visit, which will be
Yeah.
fun. I can't wait.
Your mum
Mum,
is.
yeah, visit me. And I'm going on holiday in the beginning of the year or the first quarter, yeah, in March.
Mm,
So things to look forward to,
definitely.
definitely. Mm. But sadly, this is your final
Yeah.
episode.
My final episode. Yes.
Meenal is leaving us to pursue other interests. I don't
Yes.
know. And we will have a
Mm,
new co-host in the new year,
which will be exciting.
which will be exciting. Season 2 with
Season two.
co-host 2.
Out with the old, in with the new.
I would welcome you back with open arms, Meenal.
Oh, that's good to
It is.
know.
Anytime. Anytime.
Yes, maybe I can guest star and do those questions that we did with the lovely Andrew last week.
Yeah.
Okay, shall we get into the first story?
Sure. What story do you have for me, Meenal?
Well, it's one that, to be honest, has been in the news a little bit, and we can talk about the other effect of it, actually. Something related, but not quite. But anyway, it's in The Guardian, and the title reads The Four Priorities for Tackling Medical Misogyny in Australia. So, for those of you who did not know that is a thing, it is a thing. So, article says that women are being harmed and left in pain because many medical trials and guidelines ignore them. A paper published in the Medical Journal of Australia in 2019 found that across the board range of health areas, data had been collected for men and generalized for women. Last week, the federal government announced the formation of a National Women's Health Advisory Council to address medical misogyny that occurs due to a combination of social prejudice, medical ignorance, and research exclusion. It can lead to catastrophic health outcomes for women. The president of the Royal Australian College of General Practitioners, Dr. Nicole Higgins, will act as the special advisor to the council. She says it's unacceptable that women with severe pelvic pain caused by endometriosis have their symptoms repeatedly dismissed or ignored, for example. Australian women living with the painful and often debilitating condition have had to wait an average of 6.4 years before being diagnosed and often undergo surgery that don't help or cause harm. It's not good enough and change must happen now, Higgins says, which is quite shocking, but not unsurprising, especially for endometriosis in particular, because there have been, as we know, quite a few celebrities who've come out with these sort of things and not knowing that they had it for years. Guardian Australia spoke to 5 experts to find out what areas they think the new advisory council should provide, prioritize. End of obstetrics violence. So this is number 1. This was quite shocking, but I read about stuff like this a couple of years ago. Shocking, not yet surprising. Western Sydney University midwife Professor Hannah Dahlan says childbirth must be high on the council's agenda. She and her colleagues recently published findings from a national survey of 8,804 women that found more than 10% of those who gave birth in the past 5 years felt dehumanized, powerless, and violated by health providers. They experienced psychological and emotional abuse, non-consensual care, and others were threatened and yelled at. Dahlan says, more alarmingly were the experience of physical assault such as forcible restraint or being held down for non-consensual vaginal examinations. Dahlan says birth trauma affects about 1 in 3 women, yet is regularly dismissed or ignored. When English is not a woman's first language, or they are Aboriginal or Torres Strait Islander, they experience even higher rates of obstetric violence. Postnatal care continues to be the poor cousin of maternity care, where we leave women and their partners unsupported too early following birth, with postpartum women's health services that are patchy and hard to access, she says. We need this Women's Advisory Council, and let's hope childbirth is finally on the agenda so all women finally get the care and respect they deserve. It is shameful in 2022 that we must fight for what is basic human right. I agree.
Hey, hey.
Exactly. Secondly, address the tragic outcomes for Indigenous women. I should say we were talking about tragic outcomes or health disparities between Indigenous Australians and non-Indigenous Australians when I was in high school.
Yeah.
The council must urgently address institutional racism, the social and cultural determinants of health, and greater uptake in cultural safety, says Adjunct Professor Janine Mohammed, of the CEO of the Aboriginal and Torres Strait Islander Health Organisation, Loitja Institution. Aboriginal and Torres Strait Islander women are twice as likely to have cardiovascular disease and to die from coronary heart disease or stroke than non-Indigenous women. They also die 7.8 years earlier than non-Indigenous women. As the National Women's Health Strategy acknowledges, Aboriginal and Torres Strait Islander needs are different, and inadequate healthcare can result in tragic outcomes, Mohammed says. The intersectionality of racism and misogyny impacts the health and well-being of Aboriginal and Torres Strait Islander women who experience a higher burden of disease than non-Indigenous women. It is vital that we focus on an Indigenous-led research agenda by and for our peoples, and with the targeted research strategies that support and grow Aboriginal and Torres Strait Islander health force. Number 3, give women the right medications and doses. So Dr. Laura Wilson led a study just published in the journal Nature Communications that found women are up to 75% more likely to experience adverse reactions to prescription drugs compared to men because of different physical traits. The author writes, a historic use of male animals in preclinical research and male participants in clinical trials has resulted in significant bias in the health system around the world. Women have suffered from historical neglect in preclinical and clinical research. Interesting, we both work in research and did not think of this really well. I didn't anyway. Wilson from the Australian National University says this has translated in us knowing far less about the severity of symptoms and efficacy of treatment in women as compared to men. Medical research must include sex-based analysis, she says. That is, not only are female animals and women included in biomedical research, but researchers must present sex-specific results rather than just correlating their results for sex, for example, by removing the impacts of sex-related variations in their analysis. She says the current approach by some researchers of correcting male-based results to include women by making assumptions about females has proven problematic. Many of the assumptions about including females in biomedical research are incorrect. For example, that the menstrual cycle will include additional variation in the experimental setting. She says it would be very valuable for future research to consider applying big data and meta-analysis approach to obtain a more complete and holistic understanding of sex differences.
Wow.
Yes.
Actually, what's interesting to me is I never thought about it. I'm playing devil's advocate here. You know, we open a trial, we recruit patients, we don't think, oh, what sex are they? Or either there could be 80% male, we wouldn't even really realise. But then there's also cases where some diseases that we're investigating are more prominent in males or more prominent in females. There's that aspect as well.
Yeah, there is, but we have, for example, we know that, say, for example, trials we do in breast cancer, we do go out of our way to make sure that the consent forms don't say women and don't exclude men, because we're aware that men get breast cancer.
Very small proportion. Men get breast cancer.
Exactly. So we are very conscious of including that in the population. I think maybe that's also what it's more about.
Yeah. But also as well, I guess, you can't have, like, that's a really good example. Because at first I was thinking, well, then trials should be stratified, male and female, like targeting equal numbers. But then you can't really do that in some diseases because it's just more prominent in one sex. And like for breast cancer, men definitely can get breast cancer, but I think it's still more prominent in women than it is in men.
Oh, 100%.
So I guess what you could do is stratify as a representation of the population. So if it's known that, you know, men and women get breast cancer, but 80% of people will diagnose with breast cancer are female, then you want to stratify your trial 20% male, 80% female. That's how I would approach it, I guess. But I don't think companies are doing that. And then anyway, and even if you do that, then it's also about how you interpret the data when you get it and whether you consider those things.
Yes. Well, I think because I think generally, though, they haven't used women a lot in clinical trials. So,
yeah, especially historically.
Yes, exactly. I mean, it makes sense obviously, when you talk about treatment trials, it's harder to control. But say, for example, you're just looking at healthy volunteer trials, maybe it should be stratified by sex. Like, it should be more important to have a balanced representative because it just wouldn't make sense otherwise. But I don't think that that's what's been happening. So,
no,
yeah.
Like preclinical or phase 1.
Exactly. Yeah. Okay. And the fourth was trans and gender diverse experiences must be included. So Star Lady is the program manager of the Zoe Bell Gender Collective, a trans and gender diverse led advocacy organization. She says there are numerous overlaps between the experiences of discrimination of cis women and trans and gender diverse people. This includes issues of bodily autonomy, sexual harassment, the refusal of access to healthcare, poor treatment, and a lack of knowledge about specific healthcare needs. In exploring the drivers of medical misogyny, understanding how rigid gender norms and stereotypes impact patient care is essential. A survey of Australian cancer patients found 58% of trans and gender diverse respondents said fear of mistreatment was the biggest barrier when accessing healthcare. and 20% said that they have been refused general health care. That's shocking.
It's shocking.
Star Lady said that she has experienced this as well. It's frightening having to assess and develop my own safety plans before accessing emergency departments. And then there's the exhaustive labor of having to advocate for safe healthcare whilst I'm experiencing life health crisis. There's this whole process makes me feel my life is not as valued as others. Star Lady also wants the role of faith in healthcare to be examined. The same faith-based services that are causing cis women harm in regards to reproductive rights also exclude trans and gender diverse people from receiving gender affirming surgeries.
Actually, that's a point, because I remember, you know, like, for example, we do a clinical trial and we're working with a particular hospital. Oh, I'll just say, if it's a Catholic hospital, because that's the only other type I'm aware of, then they make us take things out of the consent form about contraception and things like that. Yeah. So I didn't even consider that they may be not treating people.
Yeah. Well, that makes sense. That they're refusing care to people who need it. So yeah, that's and how they would handle somebody miscarrying, or I don't know. Anyway,
I just think there's no place for that in the medical community.
Yeah, exactly.
You either you become a doctor to treat everyone and help everyone, or you can't be a doctor.
Yeah, no.
Or a nurse or whatever health practitioner. It's like saying, you can specialize in certain things. So let's say I'm going to be a coach and I'm only going to support people that are black. Now, I can have a niche and a speciality, but I wouldn't turn away other people who wanted my help.
Yeah. And there has recently been in the news, I forgot the guy's name. I think he's from the UK. He's a fourth year medical student who has started raising the awareness of the fact that, a lot of medical diagnosis and things like that don't take into account people of color. So he was in particular, the one I saw, I think I saw a TikTok from him actually, but he has been in the news recently. He was talking about a particular skin condition and how in his textbook, all the examples of that skin condition were all white people. And he goes, but actually in the black population, it presents completely different, but there are no examples of that.
Yeah. And actually it's interesting because I have a doctor that I go and see every time. Now, this doctor's white. They're also British, and they also did a lot of their practice in the UK in a black community. So they, intentionally or not, are very experienced with black people's health and the differences because they practiced for a very long time in that community. In Brixton, in London, basically. So that's why I keep going to that particular doctor. But there's other things like, there's so much that doesn't get taken into account. Like, for example, BMI. This is really interesting. But it is an ethnic thing where black people do actually have denser bones. Yeah. It's actually a fact, and I've read it in some journals. Yeah. Which means part of your weight is your bones, and it's just weird. It's just you've got higher bone density. I don't know why. I don't know how it happened.
Yeah.
Evolution did that. But then, so you could have a high BMI that's not in that little, doesn't fit that index. So it doesn't mean you're overweight.
No, exactly. Well, I mean, discrimination based on weight is also another thing that people are trying to fight very hard. So there's a lot of areas for improvement.
In the healthcare industry. I'm just so shocked about those obstetrics figures.
Yeah. So am I. I mean, but I did read an article a couple of years ago about this woman who had said, and was actually, she had vaginal exams where they didn't ask for consent. They literally just walked in, was like, right, I'm going to examine you. And so in they went, and she goes, they had both their hands inside me, and I had, it was just, it must be so shocking. And a few people have said this, like where you're pregnant and it's almost like you as a person don't exist anymore. It's all about the baby. So people don't even sometimes ask, hey, I'm going to examine you. Is that okay? I'm going to actually have to put my hand inside you. Is that okay? It's just assumed. I'm
It's
going to check on
assumed
the
it's
baby.
okay.
Yeah, I'm going to check on the baby. So whatever I do down there is fine. So that seems ridiculous to me.
That's
Uh,
interesting, isn't it? And I guess for the practitioner, they don't think about it. It's how they were trained
yes,
and do it every day, or like
yes,
that's what they do all day, every day. But it doesn't matter how many. It doesn't matter if it's natural to have babies. It doesn't matter. It really doesn't matter. It's still unusual for somebody sticking their hands up you.
yeah, 100%. Especially when you're in pain as it is, you know what I mean?
Mm.
You're already, yeah, like probably terrified and whatever, and you have all these people in the room, and people are doing things, and they're not telling you what they're doing.
I just think it's
Um,
interesting because it's just again that kind of idea that you just suck it up, get on with it,
yes,
because you're a woman and because this is natural and it happens all the
yes,
time. Just because something
yes.
happens all the time.
Yeah, exactly. No, it's crazy. And don't even get me started on how partners or husbands get a say in what kind of, anesthesia you can do or whatever.
Oh, I didn't know that.
Oh, well, because a lot of people ask them, or they, sit there and go, no, 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 we're going to opt for a natural birth. I think it's much better and much healthier for the baby. It's like, I'm sorry, but you're not giving birth to a 4 kilo baby. So,
Oh, I know that, but I still think that this is the whole argument about the woman's decision over what happens with their body.
exactly.
A choice, even if she's carrying a baby,
Mm.
even when she's carrying a baby.
Yeah, it's her body, so it should ultimately be her decision.
But a reason this story stuck out to me is because I was just talking about it with a friend.
Hmm.
And like, it's only after that, I guess, that I saw the term medical misogyny, the gender
Hmm.
pain gap,
Hmm.
and stories around it. There's even somebody's written a book about it. And I just think you, then it's almost like you have this life experience and
Hmm.
things just pass you by. And then you learn something, and then all of a sudden you reflect and you're like, ping, 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 all these examples of like, oh my gosh.
Hmm.
When you talk to your mother, or you talk to your aunties, or you talk to your
Hmm.
your elders basically who are going through births and going through
Hmm.
menopause and going through these women's things. Depression, I feel, is linked to menopause.
Hmm.
Some depression, not all depression. And this how the suffering is just expected. Just get on
Hmm.
with it. Hot flushes, all this kind of stuff
Yeah.
that there's no real research into.
Yeah.
We're just not being. It's been overlooked, and it's just like suck it up and get on with it.
Yeah. It's all very natural.
It's all
That's what
very
everybody
natural.
says, whether it's childbirth or menopause or pain that women feel during periods, or now I've discovered during ovulation. That's a new thing.
Yeah, some people get pain. Yeah.
Yes, a lot of pain. And it's just like, oh well,
That's just natural. It's just a thing.
it's just a thing.
Yeah.
I can't tell you a few men that I've talked to about that, or period pain or whatever, who sort of go, "Oh, but I don't take paracetamol and Nurofen or anything. I never do. I don't need it." It's like, "Oh, good for you." I take both every 4 hours when I have my period. Like,
Yeah.
and they feel as if, "Oh my God, that's so shocking." And it's like, why don't they? It's funny because they look at the amount of tablets, the pills that you take during period, and go,
Who's they? Because I don't have this experience, so who are they?
like just friends you talk to or colleagues or whatever,
Okay.
and it's like, oh, it's shocking, but they don't correlate that with the pain. They go, that's a shocking amount of pills to have to take, and you're like, yeah, but that's because I'm in a lot of pain.
Mm.
And they don't really look at it. They're just like, oh, but I've never needed that kind of medication.
You should
Oh,
just say, "Lucky you've never had that
yes,
kind of pain."
exactly, exactly.
Oh.
Yeah, no, it's yeah.
Yeah, but the obstetrics one shocks me, and the conversation I was having with the friend is how she'd had been suffering in silence for
Hmm.
years and just being told if she got
Hmm.
bad when going to the doctors, being told to take painkillers,
Hmm.
and it turned out she had really severe endometriosis
Hmm.
and really bad. And luckily for her, she found a really good specialist who is all over it.
Yeah.
And yeah, was able to perform a procedure to, basically cure the endometriosis, and which allowed her to go on without the pain, and also allowed her to be able to have children, because when you have that, having children is not easy as well. That's also an issue.
Yeah.
So I think it's good that we've got celebrities talking about endometriosis, because it's kind of like a silent live with it. I know actually two of my cousins had that problem. So it really is important not to suffer in silence. And if you're not being listened to, go and find someone else.
Yeah. But I think that in general, medical practitioners must be trained early on to, to try and help people that don't fit the cis male, whatever.
Oh yeah, the cisgender trans community, absolutely. But then there's also this. I mean, in Australia, at least, definitely not so much in the UK, unless it's private, like private. See, difference between Australia and the UK, and I can't speak about the US. I feel like in the US you have to pay for everything. There's minimal available healthcare options for free, I feel. I don't know, I've never lived in America, but that's the impression I get. Whereas here, everybody has private healthcare. It's kind of like, not you have to, but you kind of have to. So it becomes the norm. People budget to have affordable private healthcare. It's affordable, I think.
Well, depending on your income level, I guess.
Depending on your income level and your responsibilities. For I don't know what percentage, but for a high percentage, it is affordable. And obviously, there's different levels what you get. I don't pay top whack private healthcare.
Well, I mean, to be honest, I think it's a little bit of a myth when we think Australia that doesn't. I mean, there are quite a few people that live below the means, because I remember a few years back when the Liberal government decided that they wanted to not bulk bill all general practitioner visits, and there would be a $7. It wasn't very much. It was $7 on top of, I don't know, you'd have to pay somehow. But actually a lot of people came out to say that's not affordable. It will actually be detracting people from going to their general practitioner if they have to top up. It's just not okay. So things like in the western suburbs, for example, you'll find most GPs bulk bill. It's a standard thing. Because people won't be able to afford it otherwise. Whereas, of course, if you go towards, in a city probably, or in a west,
you'll find people don't bulk bill. Yeah,
majority don't bulk bill.
Yeah, and if you don't live in Australia, you will not understand what we're talking about, because it's. I guess I feel like having lived in the UK and lived in Australia, I feel like Australia is very much an in between the UK and Australia, where you pay in part.
UK and the US, yeah.
Compared to the US, I feel like it's kind of in the middle.
Yes.
How it works. But anyway, whereas in the UK everything's free, but you might have to wait a year for a surgery.
Yeah.
And the quality varies, and some things you never get access to.
Yeah. Whereas if you have money, I feel like in the UK you can book it private, and therefore maybe the quality of service goes up.
Well, it's not even that. It's just the things you can get, because like for example, women's health. I'd say women's health is treated differently here. There is dedicated women's health medical practices and centres, which that's what I would advise for women to go having problems, to seek those specialists out. Yeah. Which is lucky we can do that. You can't just in the UK. You couldn't go. I want to go and see a specialist. It would take forever to get a referral.
Yeah,
exhaust all options.
But I must say that the woman's GP that I go to near me is actually not bulk billed, and it's actually much more expensive than normal. So some centers the bulk bill out of pocket, that the general practitioners that don't bill might be like $30 or something per visit. Whereas that woman specialist that I go to near me is like 100 and something. So it's for general practitioners, she's not a specialist. So yeah, it's just I love that we have access to that, but yeah, I think it's not as accessible to everyone.
No, you have to pay. And that's kind of what it's like in the UK.
Yeah, exactly. I remember that. I think I don't know who put me onto that show. I Care a Lot. No, this is gonna hurt. Have you seen that
No,
show?
it's not me.
It's about the NHS and one of the doctors well, they would say an obstetrician, I guess, and he delivers babies, and it's a shocking show, actually. I
Is
love it.
it?
It's a little bit depressing, it is, I must say, and like how it ends and stuff is quite depressing, but it's still like it was still amazing to watch. So
All right. I've not seen that show. What's it on?
I do not know. I will
Oh.
find it.
Because I mean, as far as the baby show was, I liked watching that One Boy in Every Minute.
Oh yeah,
Yeah, I used to love it. I always cry every episode.
on binge. This is going to hurt.
Oh no, I don't have that. Wasn't me.
Yes, but no, it's a very good show. I really liked it. And it's supposed to be a comedy. It is a comedy, but it's got a 95% Rotten Tomatoes rating and an 8.4 on IMDb.
All right, okay. So that's the story we wanted to share because it raises awareness, and also I guess it's hopeful that the government in Australia are particularly focusing on that, taking notes, which is wonderful to hear. Let's hope something positive and constructive and resourceful comes of that. And also from men out there, be more understanding. You can't compare pain. There's no hierarchy of pain. But if you felt like you're getting kicked in the balls every 10 minutes for 7 days, maybe you'd take some painkillers.
And maybe for the men whose wives and whatever partners are pregnant, and maybe just be an advocate for them when the doctors are talking to you instead of your wife or partner. Maybe just go, maybe you should ask.
Oh, it's so funny. I see that in so many situations, but we'll get off track. Buying a house, like you told me about. You were the one buying the house, but they only talk to your brother.
Yes.
Your car. I remember when I bought my car and you came with me.
Yes, I did.
Yeah. I remember feeling in one place that they just weren't taking me seriously. I don't know why, to be honest.
Yeah.
For whatever reason, they weren't paying enough attention about my needs and what I was there for. So even though in the end, it was like getting blood out of a stone. I remember trying to get a quote and, whatever. It was like getting blood out of a stone. So I remember they gave me that quote and I was like, this is better quote, but I'm going to the other place where they were a lot more attentive and listening and whatever.
Yeah.
Because they deserve the whatever they get.
But a shout out to the men who are actually very nice. I went to a new mechanic yesterday and they were lovely and, very, I always hate going to the mechanic. I don't know what it is. But anyway, they were really nice to the point where they had finished and I'd come to get my car and they'd parked the car on the driveway. And of course I paid and did whatever. And he walked me back to my car and I was sort of wondering what he was doing, but he had my keys. So I was like, I don't know, maybe he needs to check something else. But he actually got in the car and reversed out, so it wasn't in the driveway anymore and sort of facing out where I needed to go. And then he's like, here you go. And I'm like, oh, thank you. That's lovely. That's very nice.
What was lovely about it? That's what I was going to say.
Well, that action sort of set up the whole of what the service was like. Because when I came in, he sort of explained to me what he went through, what they had done last time, and I told him what needed to be done this time. And then when I came back, he showed me exactly what he'd done and why he'd done it, and it just made a lot more sense. And I don't know, there was something about the environment that made me feel like it wasn't too weird, because the mechanic I'd gone to before this time was someone who was recommended by my dad. But I remember driving up and I was like, I'm not going to go in there by myself. I don't know what it was. It was just completely full of men. Like the whole thing was just full of men. And I was just like, I'm not doing this. And so I actually ended up calling my dad and going, can you come with me? Because it just felt super awkward, like to have to go in there. I don't know. It was just this garage of like Indian men, and it was just weird to me.
What was weird about it? What was different between this one that you like and this other one?
Well, because I think it was the guy that it was just a little bit, I don't know, easier to talk to or something. I don't know. Whereas the other one, the whole environment just looked a bit weird. Like there were just too many guys hanging around, and it just looked too awkward for me to walk in there. And to be honest, when I parked and got out, everybody turned around and looked at me, and I was like, I don't want to be here. Like it was like they looked at me like I was weird just to come into, that place.
Okay.
Yeah, so it just made you feel a little bit more uncomfortable. And so I was like, yeah, I'm just not gonna. And so my dad did it, and it was fine, and it was okay. But obviously, I'm supposed to be a grown adult, so I don't really want my dad to escort me to the mechanic every time. So I was like, well, I'm not gonna go back to that guy. I'm just gonna go back to like this guy because he's
Okay.
alright.
I like the fact it explains it. I like that as well.
Mm.
Explain to me what needs to be done and what you'll do, and then when I come, I have a mechanic that does that, and they explain what they did and why, and then they give you options as well. It's like this could, but you could leave it in another couple of years or whatever.
Yeah.
So that's good
Yeah.
because it's like it's not hard to understand when they explain it that way.
Yeah, exactly.
I just think sometimes I think just because we're not an expert on something doesn't mean we can't understand.
Yes.
And like equally, I don't like the idea that because you're a man you must know about cars.
Yes.
Obviously some do, but I know plenty of that don't know anything about cars. Just talk, do they just get treated differently sometimes in some places? Anyway, we digress.
We do.
Another story. Yeah. Quick. Because this is a really good story.
Yeah.
I thought it was great to end on this beautiful story about Keeley Murphy. And Keeley started a charity at the age of 13. How amazing is that? A regional Victorian teenager has plans to take the charity she started to help children with autism and intellectual disabilities beyond Australia to the rest of the world. So at 13 years old, I've got to go over the title, sorry. Keeley's cause gives children with autism and intellectual disabilities iPads to help them flourish. So at 13 years old, Keeley Murphy was struggling in the mainstream school system. Keeley has autism and she prepared to tackle high school. She was also diagnosed with a mild intellectual disability diagnosis. Her mother, Sharon Murphy, said her daughter became increasingly withdrawn and depressed. You can imagine, right? If you get the label intellectual disability, I just don't like that label, to be honest. Because what it actually means is you're learning a different way to the mainstream. There's a different approach needed for you. And actually, I think that applies to lots of people. I feel like you're taught one way to learn, and the people that can work with that, and they do well. And then there's people that need another way, and they don't do so well. I don't think they're stupid.
No.
Or, intellectually challenged. And they call it intellectual disability. I just don't like it as a title. But anyway. Anyhow, her mother, Sharon Murphy, said her daughter became increasingly withdrawn and depressed. She thought she was stupid. And we told her she wasn't, and she just had a different way of learning, Miss Murphy said. Yeah, exactly. She came out with, you know what, Mum, we have a right to an education as much as everyone else. Absolutely. Despite her own hardships, Keeley was inspired to help other young students gain access to their own iPads to improve their lives by creating charity Keeley's Cause. While most school students do have access to iPads, the devices are often shared and required to stay on campus. The charity raises funds to enable families with children diagnosed with autism and intellectual disabilities to apply to get their own iPad at no cost. Miss Murphy, the CEO of Keeley's Cause, said the tablet was an invaluable tool that helped improve communication in classroom learning. It's their world in a nutshell. You've got non-verbal kids that can have a voice through the iPads, communicate through picture-based word apps to describe their feelings, she said. It's giving kids a sense of self-worth. Hundreds of iPads donated. More than 300 iPads have been donated to children across the country since the charity was founded 5 years ago. So she's 18 now. So now 18, Keeley has just finished year 12 and has several prestigious awards under her belt, including the Diana Award in 2020. Named after the late Princess Diana, the International Award recognises social action or humanitarian efforts. On Sunday, Keeley's cause had its biggest ever giving day. The annual event held in teenagers' hometown of Balan I've never heard of Balan, I think it's in Victoria. So families with children living with disabilities gifted toys, hampers and other goodies to make Christmas less financially stressful. More than 10,000 worth of gifts were donated this year. And Keeley said she was blown away at the response. Thank you so much to everyone that came, she said. And the charity has plans to expand reach beyond Australia, starting with Nepal and Bangladesh. We want these kids who are going to be the next leaders of our world to have everything they need to be able to live in the world as best they can, Keeley said. There you go. Great story.
Yes. Amazing that you started it so young.
Inspiring. I just love that. Do you know what else I love about it? The parents have been so supportive. Because some parents may have turned around and said, don't be silly. You can't, that's not possible.
Yeah.
How would you even do that? And she might not have known how to do that, just that she wanted to do that.
Yeah.
I just think that's beautiful. And I think it's so important that parents support the kids in that way rather than limiting them.
Yeah.
And that they had that attitude and told her that, because that's amazing.
Well, it just goes to show age doesn't have to be a barrier to achieving amazing.
Age doesn't. I mean, I know, I was nearly gobsmacked. It's one of the lady coaches that are in the group that Andrew helps with her business. She is 70 years old. She only just started to learn coaching. She's 70 years old.
I love that.
Getting clients.
Yeah.
I mean, how incredible is that?
Yeah. And imagine the life experience, really.
Yeah.
So that would be amazing in itself. So
she's 70 years old. She's become a coach, and she's getting clients, and she's 70, and she's only done that in the last few years. So when I hear people say, oh, I'm too old to do this and that, I know it's not true. I see it all the time.
Yeah.
Even too young, same thing, really. So is there anything you're thinking that you're too young or too old to do? It's never the case.
Never, never.
Never, never.
Right.
Right. Is that it? That is it. Let's say goodbye.
Yes, exactly. Wow, it's been amazing. Thank you for the opportunity. It has been. If it wasn't you suggesting it, I would never have done something like this. So.
Well, it's been a pleasure. It's been fun.
Yes, exactly.
It's been lots of fun. It's been a pleasure chatting with you.
Yes.
Over these 19 episodes.
19 episodes, really. Wow, that is a lot.
There's a lot. 19 episodes of All One Inclusive podcast. You've been fantastic. And I've enjoyed every minute. So thank you.
Absolutely.
I'm sad to see you go.
But good to welcome a whole new co-host with new ideas.
Oh, just a different perception of life. Yeah, it will be interesting when we start in the new year with a new co-host. Season 2 will be back in January. I'm not sure which date in January, but season 2 will be back in January in the new year with a new co-host, which I'm not going to say their name yet. You'll just have to wait and see. It'll be a surprise.
Surprise, yes.
Surprise, surprise. But farewell to Meenal, and thank you.
Farewell, everyone. It's been an amazing journey.
Okay. Bye.
Bye.
Bye. Take care. New year.
Here's to 2023, 13.
2023, yes.
2023, yes. Hoping it's a wonderful one for everyone out there.
Thank you. All right. Bye-bye. See you soon.
Bye.
Bye.